Hello, everybody. This is Gene Van Vliet. You've seen my face before, too many times perhaps. Welcome to our meeting. I always want you to draw your attention to our opening slide there at the very, very bottom, where it says prostate cancer is 2 words and it's not a sentence. For sure, you likely won't die from prostate cancer, but you may have a lot of issues in dealing with it if it's difficult with you. And nothing, oh. So I hope you're all dealing sufficiently with the coronavirus. It is likely that we will not be able to meet in the auditorium for the rest of this year. Till then, with the effort of John Tassi, we will continue to provide information via live streaming on our regular meeting dates, which is the 3rd Saturday of each month at 10 o'clock. And I always like to go through the people that are involved in keeping our group going. Lal Larache is our president. He's been involved with this for over 20 years. Wow. The group has actually been existing for 30 years. Secondly is me, yours truly. I'm one of the directors and I try to provide a lot of support, including a hotline. Bill Manning is a director and also a videographer. For each meeting, he makes a DVD and it's available through our website on a link called Purchase DVDs. And he does that for every meeting, including these. John Tassi, thank God we have him now. He's one of our directors. He designed our website. And now he's the one that's doing the video streaming effort. And next, Aaron Lamb will be our facilitator. He couldn't be here this meeting. Before George Johnson died, we had already acquired him, and he volunteered to be the facilitator to take over George's position. And so he will be jumping in on this in September. Steve Pendergrast does our newsletter, which just came out yesterday or day before, I guess. A lot of important new information in there. Bill Lewis always puts the meeting summary in that newsletter. Both of these guys are doing a great job for us. And just to know, we have about 900 members in our listing, and we probably are one of the largest independent groups. We don't have any religious or medical affiliations at all. Yes, I checked our stats yesterday. The emails telling people about the meeting went out to 897 people. Only 2 of them bounced. So we are getting through to people. Not if we can just get them used to using the system, we'll be more happy. Everyone is a volunteer. You can too. We have been talking for quite some time to try to get somebody to start working into what I do. After dealing with this disease for 18 years, I'm now 81 years old, and I need to get somebody to take over some of my efforts, which includes the accounting, the government reporting, so anybody that please contact me and see if you can help us out. Here's what we do to support people. I mentioned the website. It's a great one. A lot of good information there. I already mentioned the newsletter, which it comes out just before each meeting. Now we're doing the monthly video streaming. That happens on the 3rd Saturday of each month. And I mentioned the hotline. I am the hotline. Anytime you have a question or can refer somebody to us. One of the disadvantages of doing web streaming is when we had our regular meetings, we'd have around 10 new people come in that had all kinds of issues. Either they were recurring or they needed help because they just got diagnosed. So please talk to your friends and your sons and so forth and tell them that they need to be testing and get them in touch with us to to help them along making decisions, and that's the hotline to get that going. This is our purpose. We shared patient-focused experience, as we're going to do today. Most of usually it's on becoming your own case manager through informing, networking, and caring. We are not medical professionals, but a group of experienced participants, and any sharing by any one of our group may not be a substitute for your medical counsel. We need to mention this, we still need your support. We are a 501c3 nonprofit organization. Donations are tax exempt, and we are not affiliated, as I said before, with any medical or religious affiliations. We may be one of the largest, at least in California, if not the nation. During the coronavirus pandemic, we are video streaming our meetings, but our costs remain very much the same. The auditorium we used to meet in was furnished to us free. Please make donations via PayPal or by sending a check payable to IPCSG, PO Box 42014, San Diego, California 92124, if you don't read too well. Okay. Our next meeting will be Sumit Subudi, a doctor at the MD Anderson Center in Houston, with the subject of immunotherapy clinical trials. This is always very interesting to me, and my sequencing of treatments, I've done 2 different immunotherapy things, Provenge and Keytruda, to help jack up your own immune system. That makes the most sense to me to help your system fight things. Okay, today we have a Mr. Richard Russell. He's a licensed healthcare agent, and he's going to be talking to you about medical insurance plans and options you may have. So I'm going to stop share, and you can go away. There you are.
Okay, let me get that up, John. Thank you very much.
Sure.
Team 2. All right, so I'm going to try to keep the meeting short as I possibly can. And so what I want to do is let you get to know about Medicare. I've been doing this business for about 20 years, and I actually got into this after I retired from Hewlett-Packard. And what drew me to Medicare was the complexity of it, as my parents were facing a lot of issues. And if they didn't have the right Medicare coverage, I don't think they would have been able to not detour from their financial goals for longer term life. Just as an FYI, my mom is 96 and still going strong. So hopefully everything is going well for you. And please use the chat box. I will do my very best to pull up that information to see if there's any questions you may have, all right? This is not meant to be complicated. And some of it is, like I call it, like taxes. That's the way the law was passed, if you know what I'm saying. So this is my agenda. These are the top 10 Medicare questions in the United States. And people want to know is, what is it? How do I get it? You know, what does it cover? How much does it cost? You know, if I can get more coverage, where would I get it? How do I make a decision on my Medicare coverage? When can I enroll? Because that's very important. And we'll talk about that a little bit later. If you change your mind, what do you do? What do you want to do about your coverage changes? And then we'll talk a little bit about how you can save money and where to go for assistance and help. So this is a original Medicare neutral conversation. I'm not presenting anything beyond information. So what is Medicare? And basically, it's a federal Medicare insurance plan. And by law, it's the same throughout every state, okay? And it's eligible to US citizens, 65 or older, or those with disabilities after being on disabled list for 24 paid months. Then you can automatically enroll in Medicare. And it's funded by your taxes, primarily FICA taxes, which is primary for your hospitalization, all right? And it's individual health insurance. Some of you may think, oh, okay, when I was on my, company plan or another plan, I had a family plan. Medicare is not a family plan. It's an individual plan, all right? How do you apply for Medicare? Through Social Security. You would think you would apply through Medicare, but you do not. And it is not Medicaid, which is for low income, and it is not free. Okay, so moving on, who can get it? Like I just said, if you're 65 or older, younger than 65 with a qualifying disability, and at any age with end-stage renal disease or ALS, Lou Gehrig's disease, for some of those that know that formation. Now, Medicare health insurance, the card looks just like this, okay? And a couple of years ago, it went to a unique number. For those that have had Medicare for a while, you probably remember, it used to have your Social Security number right here where it said Medicare Beneficiary ID. And then you have two parts of Medicare, A and B, and it tells you when it was effective, all right? Now, what does it actually cover? Part A is hospitalization, including hospice. And Part B is your medical insurance for your doctors, whether you're in the hospital or not. And I'll go through each of these topics really quickly. Part A is your hospital stay, any kind of drug or medical use while you're in the hospital, any diagnostic care while you're in the hospital, any labs. And like I said, it also includes your hospice care, any kind of rehab while you're in the hospital, and any kind of skilled nursing when you're released from the hospital. These are kind of the fast facts about hospital care, things that are interesting. If you work for 10 years, paid FICA taxes, you are premium fee, basically for free. You don't pay a premium for Part A for you and or your spouse. You can't be denied coverage whether you have medical or financial issues. The coverage is nationwide, which means you can get a qualified hospital, clinic, doctor, as long as they accept Medicare throughout the US. The coverage and costs are per benefit period. And I'll describe that a little bit later. And when you are in the hospital, you must be an inpatient. You can't be there for observation. All right? Because if you're there for observation, Medicare doesn't kick in. All right? Now, let me talk to you a little bit about Medicare insurance. This is Part B. This is the doctor, whether you're going to see the doctor in his office or her office, or they're seeing you in the hospital. This is the surgeon in the hospital or the surgeon who does follow-up in his office or her office. It takes care of your clinical labs like your blood tests, all your major diagnostic tests, whether they be x-rays, MRIs, EKGs, which are generally non-radiological. It handles your physical therapy, occupational therapy outside the hospital, any kind of diabetes screening, medical health care, all your durable medical equipment. Now, durable medical equipment is known as DME. It covers it as long as that's been basically, if you will, prescribed by your doctor, and you're getting it from a Medicare facility. Medicare is very sticky about who prescribes and where you get it. So if you go to, if you will, Walmart, and you want to get some crutches, you just go buy them and you think Medicare is going to pay for that, it will not. No one, Medicare supplies are not considered coming from Walmart. A doctor didn't give you a prescription to get, a cane or crutches, if you will, all right? And of course, any kind of ambulatory surgery, what we call outpatient surgery would be covered here, and any kind of emergency or ambulance services. Now, keep in mind, I'm going through this quickly to save on your time, but I want to answer any questions you may have. Feel free to take screenshots of any of these slides. I've also provided them to John, and he can send them out if you want them. Again, Medicare insurance is going to have Part B. It will have a premium, and it's adjusted for income. And I'm just going to get a little thing on the side of my desk here, just to let you know that when it's adjusted for income, Medicare does this very interesting thing, and it looks back 2 years to what your income was. So this is 2020. They go back 2 years and say, what was my income in 2018? That's how they're going to calculate what my cost for the premium will be. Now, if you're single and you made $87,000 or less, you're going to pay the standard premium, which is $144.60. Now, let's say you had a great year and you made over $500,000, all right, as an individual. That same Part B premium is going to be $491.60. So those people that are doing really well, keep in mind your Part B premium will be basically adjusted for your income. But most people most people are paying $144.60 in 2020. So keep in mind, a lot of people don't realize this, and that's why we'll talk about alternatives to original Medicare. Original Medicare Part A and Part B does not cover everything, okay? So all of the cost of your care, it is not limited with the out-of-pocket maximum. I don't know if anybody is familiar with the concept, but a lot of insurance plans, whether they be individual, family, Medicare, they always generally have an out-of-pocket maximum. And it's a calendar out-of-pocket maximum. When you hit that, the insurance company picks up everything thereafter. So say you have an individual policy and it has an out-of-pocket maximum of $4,000. When you pay out of your pocket $4,000, whoever you have your insurance with should pick up all costs for the rest of the calendar year. Now, Medicare, original Medicare does not include prescription drugs. It does not include routine dental, vision, or hearing. It is clearly not a long-term custodial care, all right? And it doesn't cover excess charges. Now, I could be assigned as a Medicare physician, and if I want to charge more than what Medicare says I can charge, that excess is not covered. That's out of your pocket. And generally, Medicare doesn't cover care outside the United States. All right? Now, how much does it cost? I kind of touched on that briefly, but I want to go over it really quickly. All Medicare costs are 4 categories. You have a premium. Generally, you're premium free for A, and you have a premium for Part B. There generally is a deductible, and I'll give you an illustration. We generally have to pay a fixed amount at the time you receive a service that's covered by Medicare. And then sometimes, and some of you probably have heard this, you got to share on a co-insurance basis for Medicare costs. Generally, Medicare pays 80 and you pay 20, generally, for that which they cover. So here is an example of A. If you're in the hospital and you work 10 years or more and you paid FICA taxes, your employer and you paid for Part A premiums. So it generally is Part A premium free. But when you go into a hospital, each time you go in within a 60-day time frame, it's going to cost you $1,408. Now, if you're in the hospital for greater than 60 days, each day you're in the hospital between day 61 and day 90, you're going to pay $352 per day. This is very important because that's your benefit period. 60 days is your benefit period. If you exceed that benefit period, you're going to have to tap into what they call lifetime reserve days. And everybody gets 60 lifetime reserve days. So say, for example, you're in the hospital greater than 90 days. You need to tap into your lifetime reserve days. It's going to cost you now $704 for every day you're in the hospital if you only have original Medicare. And there is no out-of-pocket maximum, as I indicated. So I'll take a breath for a minute, see if there's any questions, any concerns. And yes, I will show my contact information at the end of the presentation if that's okay with you. If not, I can show it now. Is that okay at the end?
Yeah, what I'll do, Richard, is go ahead and that will be on the website, and it will also be at the beginning of this presentation when we edit it and put it up.
Great. And it's at the very end of the presentation as well, John.
Great. Thank you.
Okay. So I'm going to move on now if there's no other questions. Because Part A is pretty straightforward, to be candid. But let's give you an example. We have a person here by the name of Matthew, and they're in the hospital in January, and they stay 5 days. So they're still within their benefit period. Now, Matthew is readmitted to the hospital in April. More than 60 days has gone by since the first time he was in the hospital, and now Matthew stays 65 days in the hospital. That's more than the 60-day benefit period. So he's going to be released and readmitted between those two time frames. So in Matthew's case, he pays the Part A deductible of $1,408, but since he's in his benefit period, he pays nothing for those first 5 days in January. All right. Now he's readmitted in April. He pays that deductible again, $1,408. But he's in the hospital 5 extra days. So he's going to pay $352 times 5, or $1,760. So just for being in the hospital, Matthew is going to pay $4,576 for those 2 visits to the hospital, if you want to call it a visit, okay? All right. Now I'm going to move on, talk about Part B. As I indicated, the premium for Part B for most people is $144.60. Now, for people that are on Medicare and have a Medicare supplement plan or just have original Medicare, they will need to pay a Part B deductible of $198. That's once per calendar year. And then you take advantage of the co-payment structure with both Medicare paying their portion and you paying your portion, which in this case would be 20% of approved amounts for both services. And again, just like Part A, there's no out-of-pocket maximum limit on Part B costs. So I'll give you an example. I have a member, literally had prostate cancer surgery. Okay. $74,000 was the quote from the doctor in the hospital. In his particular plan, he had an out-of-pocket maximum of $3,400. He paid that upfront to the attending physician and the hospital, and then the insurance company paid the remainder. That's how it would work, because he will have achieved his out-of-pocket maximum just by writing that one check. Hopefully that's useful for you. Now, what I want to talk about here, this is very unusual, because you may take Medicare as a physician, but not all physicians will accept assignment. So we got Ellen here, and she's trying to figure out what the difference is between a doctor that takes assignment and a doctor that refuses assignment. So the usual customary doctor fee in Ellen's location is $300 for a doctor visit. And Medicare says, oh, it really should be $220. That's all we're going to cover. And if the doctor accepts $220, then he's accepted assignment. So Medicare will pay 80% of the $220, and Ellen will pay 20% or $44. So that's Ellen's cost out of pocket. Now, like I told you, sometimes Medicare is a little bit like taxes. It's just in the law. So here's a doctor that does not accept assignment. Medicare says, we'll pay you $220. And he says, no, I need more than that. So what happens is Medicare reduces the $220 by 5% and says, all we're going to pay is basically 80% of 95% of the $220, or $209. So $209 times 80%, this is a little complicated, is $167. Okay, Ellen has to pay $42. That's the difference between the $167 and the $209. And Ellen also has to pay the difference between what the assignment refusal is. So the $209, and this is a formula, it's 15% of $209 is what she pays, and that's going to be $31. So in this case, by not getting assignment by the doctor, Ellen is now paying $73. Now, this is a very simple example, but think about a really serious situation where you have a lot of doctor care, both primary and specialist. It's going to be a lot more money than this. And as I indicated, there is no out-of-pocket maximum. And that's why most people gravitate to some sort of private insurance. Now, is there any questions about refusing assignment at this point? Okay, Now, how can you get more coverage? That's something we always ask about. Now, when you enroll in Original Medicare, you have Part A and Part B. And there's certain times you can enroll, and I'll talk about enrollment in a little bit. But when you have Original Medicare, you have really two options. You can go option one, which is keeping Original Medicare and either getting a supplement, which pays sometimes the gap between Original Medicare and what they are being charged you as an individual. But original insurance for a supplement does not have prescription drug coverage. So if you want prescription drug coverage, you need a Part D policy. So you really have three policies now. You have Original Medicare, you have a supplement plan, which has a higher premium, and I'll talk about that, and you have a Part D premium. And just like the Part B premium, it is a function of your income. Part D has an adjusted amount because of your income, and I'll go into that a little bit later. Now, if you don't want to go with Original Medicare with a supplement to take care of the gap and get a prescription drug plan, you can choose a Medicare Advantage plan. Now, this is a combination plan, which includes all of your A and B. It usually includes prescription drug coverage and has a lot of benefits not covered by Medicare. Generally speaking, Medicare Advantage plans come in basically 6 different flavors, and I'll explain those in a few moments. A Medicare Advantage plan is an alternative to Original Medicare because the A and the B is included in the Medicare Advantage plan. You're still part of the Medicare program, so you still have a contract with the government for your A and the B, and your benefits are administered by the insurance company's plan. All right, so it's private insurance administrating that benefit. But there's rules because your contract is with Medicare. Medicare assigns that contract to the insurance company. The insurance company then administers on behalf of Medicare, and they are your primary contact. Now, Medicare Advantage plans, as I said, all the benefits of Part A, all the benefits of Part B, prescription drugs, and in some situations, Medicare Advantage plans include dental, cleaning and x-rays, eye exams, eyeglasses and corrective wear, hearing aids, hearing tests, wellness programs, fitness memberships, nurse line, televisits with your doctor, transportation in certain situations. So it's a lot of things that you would need if you were, if you will, on your own, or you needed help, you didn't drive anymore. Some Medicare Advantage plans will give you benefits that Original Medicare will not provide for you. And Medicare Advantage has a plan out-of-pocket maximum. It could be as low as $1,000, and it could be as high as, say, for example, $6,700. Just depends on whose Medicare Advantage plan you are participating with. Now, Medicare Advantage, I said there were 6 of them. The first 4 are coordinated care plans. Some of you have heard of health maintenance organizations, HMO. That means you can only see a certain kind of doctor within a medical group. When I say a certain kind, let's say, for example, you're in a Kaiser HMO, you can only see Kaiser doctors. Say you're in a Scripps HMO, you can only see Scripps doctors. All HMOs require a referral to see a specialist from your primary care physician. Again, all HMOs require a referral from your primary care physician to see a specialist. The average wait time to see a specialist on a referral is anywhere from 24 hours to 5 days. That's kind of what happens here in San Diego County and Orange County and Riverside, San Bernardino, LA, those general counties, okay? Now, some of you probably have heard of PPOs. That stands for Preferred Provider Organization. That's also a Medicare Advantage plan. It just allows you to go outside the network. When you go outside the network, you do have to pay more. Say, for example, to see a primary care physician within the network of the PPO, it costs you $20 to go see your doctor in your network. If you go out of that network, say for a second opinion, you may pay $50 out of your pocket. And then the insurance company may pay some or none of that amount. You may be responsible for all of the costs outside the network. Now, point of service is you pay at the time you have the service. It's a hybrid between an HMO and all the other services for doctors outside the network that you would normally be working with. And lastly, we have special needs plans. There's two kinds. There's one for low-income people. These are people that are on both Medicare and Medicaid, or people that need extra help for prescription drug costs. That would be a special needs plan based on income, sometimes called extra help. Or you could be on a special needs plan for chronic conditions, major heart conditions, diabetes, as an example. Those particular plans, chronic, require a doctor's recommendation to get in the plan. Not very difficult. You have 30 days to get a doctor to send on to the insurance company. And when the insurance company gets that referral from the doctor indicating you do have that chronic condition, then you're going to get special needs, or you get a lot more help in taking care of that. You're going to have navigators helping you, guide you through that process to make sure you get the care for whatever you need. Sometimes meal planning will be involved in that. It's beyond just typical medical care. Then the other types are PFFS. That's basically called private fee-for-service plans. And basically, that means you can go outside your network. You just have to find a doctor that's willing to accept the payment plans and the conditions of the plan. And then you pay for that as long as you find that doctor. Basically, they say they are deemed to take Medicare. And the last one is Medicare savings accounts, where say you want a high deductible, and then you put money aside in a savings account to pay for your deductibles and or your copays. All right. Now, Medicare Advantage, I think I pretty much covered it all, so I'm not going to spend a lot of time on this slide. But I did want to make sure two things were well known. You cannot be denied coverage based on your current financial or health status, including pre-existing conditions. Starting in 2021, during the CURES Act, C-U-R-E-S, passed in February by Congress, people with end-stage renal failure will be allowed to be in Medicare Advantage plans. It used to be a prohibition for Medicare Advantage plans. It no longer will be starting in 2021. Now let's talk about prescription drug coverage. There's two ways you can get it. You can get that standalone Part D coverage that I talked about along with your original Medicare, or you can choose a Medicare Advantage plan that includes prescription drug coverage. Again, both are offered by private insurance companies. Now, Medicare Part D plans need to cover commonly prescribed Medicare beneficiaries a certain set of standards. So there's a base level of drugs Medicare says you must cover if you're offering a Part D plan or a Part C plan. And within that coverage, it will have name drugs and generic drugs. Name drugs we call brand, and generic drugs are things like statins instead of Lipitor, for example. Now, in a formulary, this is just a list of the covered drugs. And the lower the number of the formulary, it basically says that's the less amount of money I have to pay. The higher the number, the higher you pay. It's sort of like a rating system when you go to a restaurant. If you go to a restaurant that has 2 stars or $2, you know that you're paying kind of a medium cost. Now, if you're going to Mille Fleur in Rancho Santa Fe, you're probably dealing with $5, paying a fair amount, looking at maybe $100 per person. Not with any wine, not with any coffee, not with any dessert, if you know what I'm saying. Okay. Now, I want to go over this with you. I'm going to go over it very slowly because a lot of people don't realize there's 4 stages to drug coverage. In these 4 stages, you could be, if you will, responsible to pay an annual deductible. Most Part D standalone plans do require you to pay a deductible. Most prescription drug plans in an MA, Medicare Advantage plan, do not require you to pay a deductible. So what this basically says is you have to basically cover the deductible prior to any insurance help on the initial coverage. So say, for example, the deductible on a Part D standalone plan is $435, which it is by Medicare standards this year. That's the most you can charge. It could be less, but Medicare says no more than $435. So you have to pay $435 for your prescription drugs within an annual period before the insurance company starts helping you with the payment. So say, for example, you get a drug, it costs $100. You have to pay that times 4.35 times before initial coverage kicks in. So when you get into initial coverage, let's say that $100 prescription now costs $10 in the insurance plan. So now the insurance company is paying $90. You're paying $10. When your out of pocket gets up to $4,020, you're out of pocket, and the insurance company's payment gets up to $4,020, you move into what's called the coverage gap or donut hole. For some of us that are a little bit older, donut hole makes a lot of sense. And what it really means is all of a sudden your prescriptions cost more. In today's world, your prescription drug coverage for whether it be generic drugs or brand drugs is 25% of retail. So when I was talking about the initial coverage, that same $100 retail price you were paying $10, when you move into the coverage gap, you're now paying $25. So you're paying 2.5 times more. When your out-of-pocket costs, not the insurance company, but your out-of-pocket costs reach $6,350, you move into what's called catastrophic coverage. And now you're paying very little, very small amounts, $340, $850, that kind of amount for generic and brand drugs. Just not to frighten you, only about 15% of the nation ever get into the coverage gap, about 15%. The cycle is good from calendar year January 1 through December 31. Now, when you get prescription drug coverage, you only need Part A or Part B or both. You may be required to be at a pharmacy network, and the costs and coverage within the plan will vary by plan, and they may charge more each year. And there is a Part D premium penalty for late enrollment. You have to enroll within 63 days of when you qualify for Medicare. So if you get your Medicare in June, you have 63 days. Basically, in August, you need to have a prescription drug plan in place to not have that late enrollment penalty. Now, let's talk about Medicare supplement insurance. This is also private insurance. You need to have original Medicare Parts A and B. It cannot be used in conjunction with having a Medicare Advantage plan. So you either have a Medicare supplement or you have a Medicare Advantage plan, either or. Right now, there's 8 plans that are standardized by the federal government. So in every state but 3, that's Maine, Minnesota, and Wisconsin, the federal government has standardized 47 plans, if you will, times 8 throughout the nation. The 3 states, Maine, Minnesota, and Wisconsin, they have their own state plans, what the federal government says are deemed credible and are similar. Now, in a Medicare supplement plan, you got to keep in mind that what original Medicare pays, the supplement will pay. So if you have A and B deductibles, the plan will pay it, right? So that 14 and 8 deductible, depending on which plan you have, you will not have to pay that in a supplement. You will have co-pays and co-insurance. You will have coverage for excess charges, depending on which plan you have. You will have help beyond the first 365 days. Hopefully, you're not in a hospital that long. It will pay for your blood transfusions, and some plans cover foreign travel for emergencies up to a plan limit. Just like original Medicare, they do not cover prescription drugs. They do not cover dental, vision, or hearing. No eyeglasses, contacts, or hearing aids. The exception would be if you have cataract surgery, your glasses would be no charge. Any kind of custodial care, like long-term care in a nursing home, doesn't cover it. Okay? So you might want to take a photograph of this. It's a pretty complex screen. I'm going to go over the differences in generic terms. But if you have a camera or a cell phone of some sort, might want to take a picture of this.
Hey, Richard,
These plans,
these slides will be available up on our website.
great. All right. So I just want to make people aware, if you're just turning 65 this year, this Plan C and Plan F will not be available for you. If you turned 65 prior to 2020, you were eligible for Plan C and F. In 2015, the federal government via Congress decided that they needed to do something called the doc fix. Maybe some of you read about that. Not enough money was going into doctors because people were avoiding that annual deductible, that $198, by having the C plan and the F plan. So if you had the C plan and the F plan, and some of the audience may have that plan, you're not paying that $198 deductible. But going forward, all other plans, you have to pay that $198 deductible. Now, in one situation right here, for example, the Part A deductible to go into the hospital, Plan A doesn't cover that. So you're paying that $1,408. All the other plans are paying some or a portion. Okay. So that's just basically what I want you to have a feel for. Now, the good thing about a Medicare supplement is you have year-round enrollment. But if you enroll within 6 months after getting your Part A and Part B combined, or turning 65 or older with your Part B, you can enroll in a Medicare supplement without underwriting. That means no pre-existing conditions are going to be an issue for you. You have nationwide coverage, so you have the freedom to choose any provider that accepts Medicare. You're guaranteed renewable, so you can get that plan renewed every year, guaranteed, as long as you make your premiums and you didn't make any false statements on your original application to get that plan. Now, plan premiums vary, even for the same coverage, depending on the insurance company. And plans with more coverage, guess what? They generally have higher premiums. So if you have a plan that covers most everything, that's going to be the plan that has the higher coverage premium request. Doesn't matter who the insurance company is. So when you want to do that, you want to shop around. Keep in mind, even though you're paying a premium for that supplement, you still have to pay that Part B premium to Medicare. Otherwise, Medicare will not be in existence, is what they're basically telling us. Okay? How do you choose? I'm not going to go through all the A, B's, and C's here. I'm just going to go through it very quickly for you. Because I think at the end of the day, I'm coming back to this summary slide. When you get your original Medicare, you got A and B. You can decide to complement that with a supplement plan and a prescription drug plan. Keep in mind, if you don't get a prescription drug plan, within 63 days that you qualify for Part B, and you're on Part B, you'll get a Part D penalty within 63 days. All right? Or you can go Medicare Advantage, which is all-inclusive. I call it a combination plan. Remember, there were 6 of them, and it combines A and B. It generally covers your prescription drugs, and it does cover additional benefits. For any veterans out there, there are plans that cover everything but prescription drugs, because the Veterans Administration and generally private insurance companies, they don't talk to each other as far as making a prescription cross between systems. That's the easiest way to describe it. But if you got great VA benefits and you want additional coverage, you can get that with an MA, Medicare Advantage plan only, without prescription drugs. And generally those plans are $0 premium. Now this is the plan I wanted to kind of like give you an understanding of. What considerations would you as an individual want to think about if you want to get a supplement versus an advantage plan or vice versa? Now, I'm going to talk about the 3 C's: coverage, cost, and convenience. I'm going to start with coverage. It pays some, but not all of your costs. It does not have drug coverage costs, but you have nationwide coverage for any doctor that accepts Medicare. So you have the freedom to choose. Whereas a Medicare Advantage plan provides all the benefits of original Medicare and beyond. It offers you generally drug coverage, but you have to stay in a provider network. So let me give you an example of that. Except for emergencies or urgent care, you need to stay in a network for Medicare Advantage plans. If you have a favorite dermatologist in New York City, you're going to pay that out of your own pocket if you have a Medicare Advantage plan. But if you have a Medicare supplement plan and that dermatologist, he or she takes Medicare, they'll pay the bill. Your insurance company, your private insurance company will pay that bill. Now, if you look at costs, the plan premium for Medicare supplements is determined by the plan you keep, just like the Medicare Advantage. So conceptually, they're the same. If you have a drug plan premium other than the costs added, then that's going to be a concern for you, because you're going to pay a premium anywhere from probably $15 to $120 for a standalone prescription drug cost. I have a question here. Let me take a second here. Let me get this question. It comes from Joel. And Joel wants to know, if you have a diagnosis prior to switching to original Medicare, will Medigap insurance cover your costs related to that condition if 6 months after the initial enrollment? So the question is, I have a prior condition, but I don't have original Medicare yet. Is that correct, Joel? So when you sign up for original Medicare, you cannot be denied. And so when you are 65 or when you turn on your Part B, you may sign up for Medicare insurance without underwriting. And Joel says yes, that was his question. So if you have a pre-existing condition prior to signing up for original Medicare, they have to take you. Original Medicare has to take you. When you get your Part B, when you're 65 and you get your Part B, you have 6 months to enroll in a Medicare supplement plan without underwriting, So pre-existing condition would not be an issue at that point. After the 6 months, it would be an issue. Okay. Now, again, on the cost, out-of-pocket costs depend on the plan you choose. The co-payments, co-insurance for most coverage services are handled throughout, and they have an annual out-of-pocket maximum. So the thing I like people to think about from a convenience perspective, if you have a Medicare Advantage plan, and this is not for everyone, If you travel a lot, you need access to doctors, you need a lot of, second opinions, whatever the situation is, you're better over here in Medicare Supplement, even if it costs you more, because you're going to be covered more often than not. I have moved people out of Medicare Advantage plans into supplements because they needed to see other doctors outside the network that their plan was providing for them. And that's okay. Now, on a convenience side, keep in mind that when you're in a supplement, you're actually dealing with 3 different plans. You're dealing with the original Medicare, the supplement, and the Part D drug coverage. Okay? When can you enroll? Now,
Hey,
you can
Richard,
enroll in Part A.
let me ask a quick
Go ahead,
question following
please.
up on Joel's question, which triggered one of my questions.
Sure.
Let's say I turn 65 and I'm still working using my insurance through my work,
Yes.
which is much better than any insurance plan out there.
Okay.
So I work for an additional 8 months. I'm not going to sign up for medical for Part C, D, E, F, G, anything. I'm just going to go with the bare minimum Medicare. By law, I have to sign up. But what happens after the 6-month period? Am I going to be penalized and have to go through underwriting?
If you're still covered by your employer coverage, you don't have to sign up for A or B. All right.
Correct. But I guess the question was 6 months go by, let's say 9 months, I then
Okay.
leave work and I now sign up for the rest of the coverage, the Medigap. Am I going to be underwritten then?
Okay.
Because
You
it's the
have,
6 months past my 65th birthday.
okay. If you want a Medigap plan and you lose your coverage by retiring, or you lose it involuntarily, you have 8 months through a special election period to sign up for Part B. I'll go through that in just a moment, John.
Oh, great. Thanks. Sorry to.
No, it's a great question. So those people that are getting Social Security benefits when they turn 65, or getting Railroad Retirement Board benefits when they turn 65, will automatically get their Part A, Part B Medicare, automatically. Now, if you are receiving Social Security disability benefits and you've been on it for 24 months, in the 25th month, you will automatically get your Medicare Part A and Part B, regardless of age. I have members that are in their 30s because of disability. After 2 years of disability pay by Social Security, then they qualified for Part A, Part B Medicare. Now, if you don't get Social Security, you have to personally enroll yourself by either going online or faxing to socialsecurity.gov, because Social Security offices are not open right now because of the COVID virus. So there's a new plan where you can either call Social Security directly and they'll enroll you, or you can fill out the plan and fax it to them and they'll enroll you. My suggestion during this time frame is to call Social Security. It goes pretty quickly. Because of COVID, I would say 30% of the people that I've signed up in the last 5 months lost their job due to a furlough or a downsizing within the company, just so you know. So that has increased. And so Social Security is making it easier for you to get Part B. So you may refuse or delay enrollment in Part B, but you only have 2 months to get into a Medicare Advantage plan after you get into Part B versus the 6 months for a supplement. Okay, now here's general enrollment for Medicare. You know, if you missed your enrollment period, so that's the first 3 months before your birth month and the last 3 months after. So you have 7 months to sign up for Medicare. If you didn't do that, you have between January and March of the next year to sign up for Part A and Part B. If you did not get your Part B when you were qualified to get it, you will be subject to a late enrollment penalty, which is basically 10% for every 12 months you did not get your Part B. So it never goes away. It's a late enrollment penalty that lasts forever. So it's a bad penny, if you will. If you get your Part A and Part B, you have 3 months to sign up for a C or D plan, okay? C or D plan. Okay, I'm looking at the questions. All right, here's the Medicare Supplement Open Enrollment. 6 months after you're 65 or older and enrolled in Part B, no medical underwriting. John, hopefully that answers that question. You may enroll in a plan later, but you may be denied coverage or charged more based on your health history. So if you go beyond the 6 months, you will be subject to underwriting and medical questions on your supplemental plan enrollment form. Now, these are the special election periods working past 65, as you brought up, John, and others may have this question. Like I said, you have 8 months to enroll in Parts A and B. When you lose your coverage. So for example, those who delayed your enrollment, you may enroll in Part A and B within that 8-month time frame. When your Part B enrollment triggers the Medicare Supplement Open Enrollment. So as soon as you get Part B, you now have 6 months to get into a supplement. Forget the 8 months. Whenever you got it, you got to go. You only have 2 months to get in Part C and Part D during that special enrollment. 2 months. And I've already talked about the Part D and early. You want to get that done so you don't have the penalty. All right. All right. So here's the late enrollment penalties I've been talking about. Part A, none if you qualify for premium free. Otherwise, it's 10%. Part B, none if you qualified for the special election period. Otherwise, it's 10% for each of the full 12-month period. And Part D, none if you are in within 63 days with credible coverage. COBRA is not credible coverage. You need to have credible coverage. If you're working and you retire, make sure your employer provides you with a document indicating you had credible Medicare coverage. That way, you're not subject to a late enrollment penalty. Otherwise, you pay 1% of the average premium for each month that you don't have it. So if the average premium is 1%, if the average premium is $35 for Medicare Part D, for every month, 1% would be 35 cents. So every month that goes by, 10 months goes by, you're going to pay $3.50 on top of that Part D premium forever. Late enrollment penalties never go away. Some people think, oh, I paid the penalty, I'm done, right? No, they stick with you as long as you have a plan, as long as we are alive. It's punitive, basically. When can I change my coverage? Well, every year between the 15th of October and the 7th of December, you can switch from original Medicare to a Medicare Advantage plan, or go from original Medicare down to a supplement plan if you want. You can basically, if you want, go from your Medicare Advantage plan and go back to original Medicare so you can get that supplement, if you will. You can switch from one Medicare Advantage plan to another within the same insurance company or a different insurance company. And you can join, switch, or drop your Medicare prescription drug plan if you find one that's better. All of that switching around, your new insurance plan will take effect January 1 of the next year. So starting October 15th, 2020 through December 7th, 2020, you can switch from your A and B original Medicare to a Medicare Advantage plan. You can switch from your Medicare Advantage plan to another Medicare Advantage plan, but it won't be effective till January 1 of 2021. All right?
Now, when we
Now,
switch, Russell, is there a possibility of underwriting?
yes, because you're not in your open enrollment period if you're not just 6 months past your Part B.
Thank you.
You bet. Now, for Medicare Advantage coverage only, this does not apply to Medicare Supplement. If you have a Medicare Advantage plan, there's another open enrollment period that was just brought up this year by Medicare. So for Medicare Advantage plan members only, you have 3 months to switch to another Medicare Advantage plan or return to original Medicare. Anytime you return to original Medicare, you have the option to get a supplement. But you only have one coverage change allowed. One coverage change allowed during that 3-month period. So you can't make a change in January and hope you can make another one in February. You get one time frame within those 90 days. All right. Now, special enrollment period qualifying events. What defines a special enrollment qualifying event? If you move out of your service area, you can get another prescription drug plan or a Medicare Advantage plan, no problem. If you move within the plan service area and there are new plan options available, you can switch. If you lose or leave other healthcare coverage, you can change. If you qualify for a special needs plan, say for example, you develop a serious case of diabetes, that would be a qualifying event to allow you to go into a chronic special needs plan. You can move into or out of an institution if you are in a nursing home. If you move out of it, that's a special qualifying event to get into a new plan. If you move into it, you can move into another plan. If you receive or lose financial help from Medicare, that would be what I call the low-cost plans through Medicaid. That's another option. If you gain it or lose it, you have the opportunity to sign up for another plan during the 2 months after you have that qualifying event. Hopefully that's clear. It's a mouthful, I apologize. Ask questions if you have them. How can I save money? Well, the best thing is to utilize all the preventative services. There are probably 30 preventive services that Medicare covers zero cost for you. Mammograms for women, prostate exams for men, colonoscopies, flu shots are covered. Stay within your provider network if there is one. Always ask your doctor, can I get a generic drug instead of a brand drug? The utilization of preferred network provider pharmacies or mail order generally reduces your cost. And always understand your status in the hospital. As I indicated, I'm an outpatient or am I an inpatient? Outpatient, no coverage. Inpatient, coverage. Financial aid assistance. Now, what we have here is the state hospital insurance program. You can utilize that to get either extra help. You can qualify through Social Security, your Medicaid. I can help people, qualify for that if you have low income. There's Medicare savings programs that help pay for Part A and Part B, which is also a function of low income. You might say, well, what's low income? A low income in the state of California would be monthly income of $1,069. So your A and B would be paid for by Medicare and Medicaid, but you can't have more than roughly $8,000 in assets, not counting your house, not counting your car. But if you have $8,000 in an IRA or a pension or in stocks or in the bank, you would not qualify. And then there's also help for people that need to be in a totally, if you will, all-inclusive care for the elderly. It's called PACE. You probably hear it on the radio sometimes. Now, where do I go for help? Well, part of it is today what we're doing right now. Medicare made clear. we have a website called MedicareMadeClear.com where you can get some additional information, videos, quizzes, downloadable guides, newsletters. We have Facebook pages, YouTube for us, and also for your own organization, which I thank both Gene and John for. And for those that need Medicare Made Clear in something other than English, Spanish, Vietnamese, and Chinese, it is available on our website. Now, every year, about 30 days before open enrollment, we have something called learning or getting to know about Medicare. And we have education for those 7 days where you can ask all the questions you want. This is a precursor to that. It's the same presentation. So if you just have questions, I'm going to be doing some online videos. I'm going to do some in-person educational events throughout the county if we're able to open up, and we can provide that information to people that have interest throughout the San Diego County. Other resources are Medicare.gov. Medicare.gov is available 24 hours a day, 7 days a week. A lot of people don't know that. You can get a person during the day on Sunday, not 24 hours a day, but during the day, oftentimes. You can always contact your local Social Security or Medicaid office if you need help. You can also call me or anybody within what I call HICAP. That's an organization, nonprofit, that helps guide people through the various plans for them. It also handles elder law. And this is my contact information. I want to thank you. Thank Gene and John for inviting me to participate with you today. It's been really interesting to learn about your organization, and hopefully you learned a little bit, but feel free to contact me, call me, email me, whatever is convenient for you. So I give it back to you. Are you going to pick it up, Gene, now? I give it back to Gene?
Yeah, Gene, you need to unmute your mic, buddy. I see your lips moving.
There we go. Got me?
Got
Yes,
it.
sir.
Okay. All right, that's a great presentation. It's terribly confusing. And
I'm
that's,
sorry.
well, all of us go through it, believe me. And that's one reason that we thought it was really good to have you come in and talk about it a little bit, and to know that there's a resource out there other than an agency that's going to charge you forever to provide you information, or their main goal is to sell you insurance.
Right.
So,
Everything I do, Gene, is as a free consultation.
good. Good, good. Glad to know that. Anything else coming up there? Oh.
Someone asked a question. It looks like it came from Rodney. The answer is going to be right here, but the question is, am I an independent broker, or do I only enroll people in United Healthcare? It depends on the programs or plans you want to be in. I can offer, I'm licensed in many states, and I'm with 6 insurance companies. But I'm happy to help you with your questions in any case. Hopefully that answers your question, Rodney.
Okay, let's give it just maybe a minute or so to see if there's
Sure.
any more questions. And if not, I think, Gene, I'll let you say the final goodbyes, and we'll close the meeting.
Okay, really good. For all of you that participated, thank you. And those that did participate, please tell your friends and so forth about this ability to get information from our support group, even though we can't meet. And most of all, please remember to tell all your close friends, sons, and so forth about getting prostate cancer testing, and contact us if you have any questions about prostate cancer. That's it. Goodbye, y'all.
Gene, that's excellent. Thank you so much for everything. Thank you for the invitation.
Hold
How
on one
about-
second. We have 2 questions. It just
Oh,
popped
sure.
in,
Okay,
and I'm putting them up right now for you.
is it in the question and A, Q&A? Okay,
They're
I
coming in
see
on the
them.
chat.
Okay, if you're currently working full-time, did you say that I have 8 months to enroll in A and B and 2 months in C and D? Did you say that I should enroll in C and D at the same time as A and B? Okay, so if you're currently working full-time, you do not have to enroll in A or B if you have group coverage. So if you have credible group coverage through your employer, you do not have to enroll in A or B. As soon as you leave that group coverage, you have 8 months to get Part B. 8 months to get Part B. And when you enroll in Part B, that's the trigger for Medicare Supplement or Medicare Advantage plan. Okay, so the next question is, how large might the penalty be per year for Part D if you had an Advantage drug coverage previously? I'm going to assume you lost it or you got rid of it. I'm not certain. But here's what happens. If, for example, you didn't sign up for a prescription drug coverage when you were responsible to, i.e. 63 days after being eligible for Part B, if you get Part B and you don't sign up for a prescription drug plan, you got to do it within 63 days. Otherwise, your penalty is 1% for every month you don't sign up for it. Social Security actually does the calculation, but let's say that a prescription drug plan premium would be $35. 1% of $35 would be 35 cents. So every month you don't sign up, you're going to get that as a penalty. So if you don't sign up for 10 months, your penalty is $3.50 on top of that $35 premium. So you will pay $38.50 every month that you have that Part D coverage. Does that answer the question?
Unfortunately, yes.
Okay. Okay, the next question I have is from Bill. If you had a pre-existing condition and you go from Advantage to Supplement, can they deny coverage? Yes. They can deny coverage based on your health questions. If you have a pre-existing condition, depending on the insurance company that you work with, that is greater than 2 years, some of the companies will allow you to go on to their supplement plan. Okay? Now, other insurance companies require you to be, if you will, free of that pre-existing condition for 5 years. I represent just so you know, and this is not a commercial, some of the people I represent, it's 2 years, you don't have that, you're in remission, you're not taking any kind of serious medication to keep that pre-existing condition from reoccurring, then you're likely not going to be underwritten, but it could go as long as 5 years in your history. So you're always doing a history.
I see one question up there. Uh-oh.
Depending on the insurance company, and this goes back to you, John, 2 to 5 years, depending on the insurance company. So generally, you would be okay.
That is good news.
Yeah, can I get in there just now?
Yes, sir.
Okay, I see one that passed up over there. Says, Gene, remind everybody to donate generously. And I just did. And I asked that in the beginning that even though we're not meeting, our costs are still the same. So please help us out and go donate through PayPal or through the address that showed on my first slide.
And also you can go up to our website and there is a link. You simply click it and you can donate.
There you go.
Let me get that website up right now.
IPCSG.org. It's really easy to get to it.